good luck for the future.
Thank you very much.
The JSI Research and Training Institute, in partnership with the government of Sierra Leone, has celebrated the impact of one of the largest health investments, highlighting the accomplishments moving from crisis to recovery and transition to resilience period. The event gives an opportunity to celebrate the tremendous accomplishments over the last 18 months. Speaking during the event at the Radisson Blue Hotel in Freetown, the outgoing U.S. ambassador to Sierra Leone, John Hoover, said that the U.S. government is proud to partner with the government of Sierra Leone to help achieve the President's Ebola Recovery Plan (PRP) for health. He revealed that as the country began the difficult process of rebuilding and strengthening the health sector in the wake of Ebola, the United States government stepped up to assist President Nkrumah create the 24-month post-Ebola recovery plan in 2015, which allowed donor countries like the United States to quickly understand where and how they could support.
2014 and 2015, that was an experience which I will never forget. It was a very difficult time for all of us who were here, but at the same time, it was a moment when we came together and worked together closely to help support Sierra Leone and get through a very, very difficult and dangerous time. I really think of my time here in Sierra Leone more as a time when I had opportunities, not a time where I had to face challenges. I have a great team at the U.S. Mission, and we've had great partnerships with the ministries, not least the Ministry of Health, and with State House, with the President, and with all the implementing partners and other international partners who are here today. So it's been a wonderful time for me, and I will take great memories from Sierra Leone when I leave. And then the other question about whether I'm satisfied with the status of the healthcare system, I think the Minister answered that question in his remarks. I think we should look back and be proud of the immense progress that we've made over the last few years. I mean, extraordinary progress in just 2 years after the end of the crisis. But we can't look back for too long. We have to look forward, and all good things must continue. So we have to keep doing what we've been doing, and the United States will continue to support improved health of Sierra Leoneans going forward. Thank you very much.
On his part, the Chief of Staff, Saidu Konton-Sise, in his address, expressed gratitude to the U.S. government for the support, especially in the health sector, and described the occasion as a symbolism of recovery from the Ebola crisis. He said the work of the JSI Research and Training Institute has helped strengthen Sierra Leone's resilience to future health challenges and has created the foundation for sustainable development.
For my part, I am delighted that this partnership, through its investment both in upgrading physical infrastructure at medical facilities and in strengthening human capacity in the health sector, has contributed a great deal towards both goals. As we come to the end of the period of the President's Recovery Plan, all of us in government will be doing a great deal of reflection on what has been learned for the future from the past 24 months, both from the many successes achieved and the strengths of the system, and from the challenges encountered along the way.
The Minister of Health and Sanitation, Dr. Abubakar Fofana, reiterated the need for a comprehensive approach in rebuilding a resilient health system in the country. Dr. Fofana, however, commended the JSI Research and Training Institute for revitalizing more than 300 peripheral health units, improving primary health care for 2 million Sierra Leoneans, that is directly contributing to the President's Recovery Plan.
The project was conceived in the immediate post-Ebola era through a consultative process that was deep, extensive, and all-inclusive to help the government and people of Sierra Leone overcome some of the most pressing health challenges faced at the time. As a result of this open, accountable, and transparent partnership approach by all parties, these projects met all the hallmarks of a collaborative partnership. It is responsive to the local needs of the people downstream because it is evidence-based. It is well aligned to all the government roadmap documents, including the National Health Sector Strategic Plan, the Post-Ebola Health Sector Recovery Plan, and the President's Post-Ebola Recovery Agenda, because it was consultative.
the United States provided approximately $300 million to support the Ebola emergency response in Sierra Leone in 2014-2015 and is now investing an additional $300 million in the country's post-Ebola recovery and long-term development. Sierra Leone is becoming a President's Malaria Initiative country to reduce the burden of malaria, with maternal and child health remaining a key priority in the Ebola recovery work. Reporting for Star TV News, this is Eric Silaskawa.